Have you ever been prescribed tamsulosin, also known as flomax, or finasteride, also known as prostate, that is for hair loss or prostate? If you don't know who I am, my name is Tom Waswa, a medical biochemist. Today I'm going to show you some side effects of these medications. An important question is, will these symptoms disappear after you stop your medications? Now let's begin by looking at finasteride, also known as prostate. Finasteride is given by a urologist for an enlarged prostate. So if you want to know more about enlarged prostate, watch out my videos on enlarged prostate. I have shared videos about enlarged prostate, everything that you need to know. I have shared about enlarged prostate symptoms. I have also shared a video on important supplements for your prostate health. So you need to know that finasteride is also used for hair loss and also in lower dosage. Now let us discuss the mechanism of action of finasteride. Now finasteride works by inhibiting an enzyme known as 5-alpha reductase. Now finasteride is found in various parts of the body, including the prostate and also in the brain. Now since this particular enzyme, that is 5-alpha reductase, is found also in the brain, and we want to use finasteride to block it, it simply means that our finasteride drug is able to cross our blood-brain barrier. Now, when finasteride crosses blood-brain barrier, it inhibits 3 important neurosteroids. Now, these neurosteroids include DHT, 5-alpha dihydroprogesterone, 5-alpha dihydrodeoxycorticosteroid. Although it is not clearly understood, it is said that reducing this kind of molecules from the brain can actually affect your sexual desire. Therefore, inhibiting this kind of molecules normally reduces libido. You need to know that most of the studies that have been done to check the impact of these particular drugs on the brain has actually been done in animals. That is why we may not have a clear answer as to how this particular drug normally works. So we may not actually clearly explain how it affects the brain like that. Now, the labeling of this medication normally suggests that there is lower than 10% risk of impotence, in addition to decreased libido, ejaculating disorders, and general sexual dysfunction. Now, the good thing about finasteride is that if you take it for a period of around 1 year and you have not experienced any symptoms, there are high chances you will not experience any symptoms at all. Now, a study on 71 men with post-finasteride sexual dysfunction found that over 90% of men have complained of decreased libido, decreased arousal, and ejaculation dysfunction. The study also found that over 70% of men have difficulty in orgasm. Now, the most worrying part about finasteride is that it can take about 40 months for the symptoms to disappear. Now, this is almost 4 years. In fact, the study found that over 20% of men had symptoms for a period of 6 years. Now, another well-known disadvantage is the nocebo effect. Now, nocebo effect refers to a situation where when a medical specialist gives an advice on the increased potential of a certain side effects on a certain patient, that patient starts thinking that they have already suffered from the symptoms. Now, the last group of medication that we are going to discuss that has got the most side effects is tamsulosin. Now, the most common side effect that is associated with tamsulosin is decreased volume of ejaculate. These side effects normally affects around 8 to 10% of men who are using this particular medication, depending on the dosage. Now, let us discuss the way in which tamsulosin can affect the volume of the ejaculate. So the first way is that this particular drug works by blocking alpha receptors. Now, the alpha receptors are located in the bladder and also in the seminal vesicle. Now, you need to know that about 80% of the ejaculate comes from the seminal vesicle. This is because the seminal vesicle contains around 80% of the semen by volume. The seminal vesicle also contains a lot of receptors. Both the bladder and the seminal vesicle normally squeeze in and out of the body through the urethra. Tamsulosin binds to receptors in the serotonin and also dopamine receptors in the brain. Now, in the process, they block the brain and also the spinal cord ejaculatory center. Now, this prevents ejaculation from happening. Now, whenever men are told that they have ejaculation problem and they need to take medications, they will rule out medication option. Now, if you have ejaculation problems, kindly consult your urologist or your primary care doctor. Let us look at the medication alternatives to tamsulosin. Now, these ones include alfuzosin, terazosin, and doxazosine. Now, the three drugs that I have mentioned above have got a lower rate of ejaculation dysfunction. Alfuzosin seems to have the lowest rate of ejaculation dysfunction, being around less than 0.6%. Now, tamsulosin and silodosin have got the highest rate of ejaculation dysfunction. Now, in case you have enjoyed this video, please don't forget to thumb up and also subscribe. I really appreciate it.